could talk, what would they say? They might be trying to tell you something important about your overall health just by the way they look and feel. Thankfully, we have someone here who speaks their language. Please welcome back the Texas Tooth Lady, Dr. Terry Alani. Hey there.
You know, I do speak the language.
You do speak, yes.
I do.
The other language she understands is when she's talking to you and you go,
exactly.
Yeah, she knows exactly what you're saying.
The only ones that laugh at our jokes because they have to.
All right, so what your teeth are trying to tell you. Let's start with sharp tooth pain. That gets our attention.
Right, if you have sharp tooth pain, you could have an underlying cavity. Sometimes you cannot tell, so that's why we take x-rays, so you can see, we are able to see if there's dark in between your teeth, then we'll be able to tell if there's a cavity or not.
How many times do people think, do I have a cavity? They just open their mouth
if you
and look to see.
Exactly,
right?
on the monitor, if you can tell, the real white, those are actually fillings, but the dark in between the teeth are cavities, and sometimes you don't even know you have them.
Right.
But if you have a sharp pain, the other thing that people aren't aware of is called cracked tooth syndrome. We see that quite a bit. You cannot detect that with an x-ray. You have to come see us. And basically, it's when you bite down and release, you get a sharp pain. And it can also be cold sensitive. So a lot of times we'll have to do a crown, and sometimes maybe a root canal. So we advise you to see your dentist.
Yeah, that's happening, especially like a week or longer. Go do that. Okay. The achy teeth pain.
Okay, now this is interesting. You can actually, if you have a sinus infection, you can actually have a dull ache on either side of your cheeks and your upper teeth. And you might think you've got something wrong with your teeth, but it's actually a sinus infection.
Yeah.
And the other thing is that it could be a sign of clenching or grinding. So we recommend a custom-made mouth guard. Usually it has to do with emotional stress or stress from a job or what have you.
Just like some people put it in their back and their neck.
Exactly. And if it lasts for a longer time, then it could be possibly the need to have a root canal.
Yeah, yeah. All right. The next one is, let's see.
Yellow or stained
teeth. Uh-oh.
Yellow?
Wait, this is how she did it. She went, the other one is, yellow or stained.
No, not true. Deborah has beautiful white teeth. But yellow or stained teeth, it's not really a sign, not detrimental or what have you, but many people have it. And believe it or not, medications that you take for high blood pressure can actually yellow your teeth.
We know some acne medications.
Exactly. And also medications that we give you, mouth rinses for gum disease. So the best way to treat it, and of course your cigarette smoking, your coffee, which we all love, tea, wine, is basically to whiten, or you can do veneers, or you can do snap-on smile. So this is a veneer case where this patient actually had short yellow teeth and wanted to have a little bit better smile.
Yeah, those are pretty. Okay, moving on to flat, worn teeth.
Now that's easy for us to detect. When a patient opens their mouth, their surfaces have been worn down, and usually it's because the patient has been clenching or grinding. Usually they'll have soreness in their joint area. Again, we do custom-made splints, and you can actually increase their opening by doing snap-on smile.
Yeah.
Or full mouth reconstruction.
Explain to me what snap-on smile is.
Snap-on smile is a removable appliance that fits over your existing teeth that changes the shape.
That literally snaps out.
Everything. It snaps in and out. It's amazing. And it's reversible.
Yeah, I love that. It's easy.
Yes.
Just pop it in, snap on, snap off, right? Okay. Gum infections. If you have recurring gum infections.
You may have diabetes. A lot of people don't realize diabetes, what it does, it actually limits your saliva flow and it causes your blood vessels to thicken. And the thing with diabetes is you're very susceptible to gum infections. So you have to make sure that you see your dentist.
Yeah. And gums are pretty resilient. They can really, you cut, bite, whatever, and they can restore themselves pretty quickly. So when they're not, that's telling you there's an issue.
Exactly, yes.
Okay. Sores in your mouth.
Okay, this could be a vitamin A deficiency. So what you want to do is eat sweet potatoes, spinach, carrots to help restore your vitamin A. Also, it could be something that's long, if it's lasts more than 2 weeks, it could be more serious, such as oral cancer. So you want to look to see if there's any raised lesions that are surrounded by white or red.
So this is what we commonly refer to as a canker sore, right?
Exactly. It's a canker sore. There's the actual herpes virus on your lip, which we can actually use a laser now that can get rid of it within 2 minutes. And it's painless. Yes. It's amazing, but you have to catch it right at the beginning.
Yeah, but a lot of people will do the over-the-counter stuff. Which sometimes I guess can be somewhat effective, but if if you want to get rid of it, knock
it's
it out.
not that effective. You really need to get either Zovirax, which is a prescription medicine at your dentist, or the laser.
Okay, then there's all the old wives' tales. The rinse it out, honey, with some salt water, you'll be good.
Exactly. Yeah, it's a virus, so it's really not going to make that big a difference.
All right, bad breath can tell you lots of things as well.
Right. Of course, we all hate bad breath, and it can actually be either a stomach disorder, acid reflux, or even a sign of liver disease.
Ooh, wow.
So you need to see your dentist.
Yeah, bleeding or swollen gums.
Bleeding or swollen gums could be a sign, and usually are, of either gingivitis. It could be hormonal changes. If you're pregnant, you can have pregnancy gingivitis. It's very important to get your teeth cleaned more frequently when you're pregnant, and also it can result in bone loss. So it's really important to see your dentist.
Yes, but that's the thing, is that there's so much you can tell. The body is interconnected in so many different ways. There's so much you can tell when you go to the dentist. You've said several times that there are people who've sat down in your chair and you've immediately said, get up, make an appointment, you got to go to the doctor.
Exactly. And what people don't realize is the bacteria that causes inflammation in your mouth is the same bacteria that causes inflammation in your arteries. So it is definitely related. So if you have a healthy mouth, you're usually going to have a healthy body.
Yeah, because otherwise it's related to heart disease, it's related to, you say you could tell with diabetes, so all kinds of things. So you go to the dentist not only to get your teeth looking good, feeling good, healthy and pretty, but to find out if there's anything else wrong with you
exactly.
too. Right?
And we'll check your blood pressure.
Yeah, yes, we will. All right, Dr. Alani, thank you very much.